Welcome to another episode of the Tobago House of Assembly's Post-Executive Council Media Briefing. This week, the Secretary of Health, Wellness and Family Development, Dr. Agatha Carrington, addresses the media.
Good afternoon, Tobago. Good afternoon, Trinidad and Tobago. I'm pleased to share this time at our post-exec meeting several areas which I think would be of importance to all of us. Areas that I will concentrate on include our efforts to create a more responsive family development department. And I will share with you what we've been doing so far. I'll also share with you and some dates that you will want to note in terms of services and infrastructure that will be launched at certain dates. We will share with you our efforts to improve access to primary care, and I'll update you in terms of the payment of our employees further to the administrative changes that have been made to support those changes. Most of us would know that International Women's Day, March 8th, several countries around the globe participated in recognizing and celebrating the efforts of women. In the Division of Health, Wellness and Family Development, what we've done is to, rather than having a one-day activity, we've launched a yearlong activities we've launched. And further to that, we've had on March 13th, a women's symposium. At that symposium, upwards of 200 women came together, women and girls came together, and the various topics that we shared included empowering women, women in politics, women in religion and leadership roles therein, women who have overcome challenging situations. We believe those areas were important as we launch the series of activities that will follow therefrom. Permit me to share with you, though, in the coming months what is expected to be delivered. And so in April, because we're focusing on our women, in April, we continue with health and wellness, and we believe that women's health is important for us to look at, and through our collaboration with the Family Planning Association, that which was approved by the Executive Council in 2017, we will build on that as we focus on sexual and reproductive health. Continuing with our women as well in terms of breast cancer, our breast cancer study will continue there and be strengthened. But a big service that we think is important because there are some unmet needs among our women, and so that our breast health service will commence to address that unmet need. Important though, we have to share the information and provide support to our women. And so in that service, we are going to be addressing quality of life issues, not just your physical functional domains, but the other areas that we think are important to our women enjoying an improved quality of life. In May, we are going to be looking at diet and exercise for women, and this is going to be facilitated by the TRHA, followed by some focus group sessions that we will have, because we believe the women will want to share their lived experiences in terms of their changing roles. And for Mother's Day, we'll be celebrating our mothers, and Step With Me would be part of that, which we will do. That is going to be an event where we will not just have a church service, but we will be dealing with our women and the healthy feet. In June, though, we will be looking at women who overcome or have overcome substance abuse. And so in 5 communities, we will be visiting Bethel, Plymouth, Keene and Bon Accord, Scarborough and Roxborough. And that is important for us to note because there are women who are challenged by substance abuse, and we are going in to do a focus group sessions again to see what is happening there. International Day Against Drug Abuse and Illicit Trafficking, that we will celebrate as well, or commemorate as well. In July, though, an important area for us is women in education, and therefore in our secondary schools, we will revisit the situation with respect to what's happening there. Our third formers, we are going to be visiting them to treat with women as they pursue the children, in education. In August, our Women Entrepreneurship Expo comes. we are going to be collaborating with our colleagues in community development, enterprise development, and labor for that exposition. You will note that through our REACH project and program, we give grants to women, most of them to women, I must say, and we will want to have them show what they've been doing. By September, Women and Nutrition is going to be delivered because we are what we eat. Let me just say, even though we are doing these activities, the routine activities continue. So by October, we are moving into women and mental health and wellness, because mental health and wellness is an area that requires strengthening, and we are working in that particular area. In October still, we're still there, Cancer Survivorship Conference that is going to be held in Tobago. Following that, or on that same day, we will launch a pink room for women. This is important for us because our women need a safe space where they can converse with each other, where they can support each other, and that is to come as well. The International Conference for Elder Abuse, though not just about women, but that conference is going to be held in Tobago, and we will give focus to our women as well. November, Women in Communities. We intend to rebuild Tobago community by community, and therefore we are going to be focusing on those women in village councils, in Mothers Union, in all those groups. We are going to be looking at that. The International Day for Violence Against Women, that comes in November. Also the International Day for International Men's Day is also in November, and we will pay attention to that as well. A group that has not been properly managed are the differently abled, and we have started meeting with them. So in December, Women Coping with Differently Abled Children, that is to be hosted. So too in January, Women with respect to diet and exercise, that is also to happen. And we closed in February, which is kind of during the carnival period where we are setting boundaries. And some of my colleagues said we're going to be moving to watch and not touch by the time we get to February. That's important for us because we are looking at several areas in family development that require attention, and we'll be focusing on that. But let me as well share with you why it's important for us to continue this whole matter of what's happening with our women, because matters with respect to not just celebration of our women, but the fact that our women continue to be challenged in various areas. And so the issues with respect to drug use, drug abuse, those be looked at. But domestic violence, which is a service area that we focus on as well, when we look at the data coming out of Tobago, it's still important for us to focus on that, and that's why we're carrying the service throughout the year. And so that the statistics that we were able to look at from 2015 to 2017, whereas in 2015 we had 4 males that reported domestic violence, there were 39 females. In 2016, whereas there were 7 males, there were 11 females. In 2017, whereas there were 2 males, there were 6 females. And therefore we want to pay attention to that. Our domestic violence service will be strengthened. Most of you will know we have a Women's Empowerment Center. Though limited as it is, we will continue to provide a safe space for families, at least 2 families at a time. In addition to this, I would want you to just to save some dates, because these are also important in terms of what we would want to deliver. Our Stroke and Diabetes Center would be launched in April of this year. So too a turning for the Moriah Health Center. We are working with a May 16, 17 date. We will finalize that because we want to make sure that all agencies are able to participate in that. This is a long outstanding project. A community residence for children at risk in Lambo, that is to be opened next month. I mentioned already the pink room, but our blue room for men is to be launched in November. So those are dates that we will want you to pay attention to. We will finalize and notify the media as and when we have firm dates. In terms of improving access to primary care or services in Canaan, Scarborough, and Roxborough, that continues because we feel that persons, rather than going to the Scarborough Hospital, they can go up to 8 p.m. at night to either Canaan, Scarborough, or Roxborough. Let me just also, before I move to the issue of the payment of employees, just speak to some other areas in terms of service provision. We've commissioned a facilities review committee to look at children's homes. And we felt it was important to engage these stakeholders who own or work in nurseries and daycare centers so that they could be better equipped to provide their service. Considering as well our focus on our families, we believe our children are important and we must look at what is provided to them. And so that owners of nurseries and daycare centers have been engaged such that they can look at meeting the standards required for licensing. And so that the intention is all those homes must meet the standards such that they can be licensed. They will be given the timelines in which they must get ready so that that will happen. We believe that's important as we seek to provide an appropriate environment for our children to be taught or to be nurtured in. In terms of the elderly in our families, we've met with several representatives of various groups during the past month. We've hosted a seminar with the International Federation of Association of Elderly Persons, and coming out of that, we formed an Association of Elderly Persons, a Tobago unit. That is to be formally launched at a date to be fixed. I mentioned before that we will have a conference in October, and that came out of that. They will also be provided with office accommodation for the association so that they can do the work required for the association. With respect to the disabled community, another group of stakeholders with whom we've been meeting. Well, Down syndrome day is soon to come, soon on us. But we have been meeting with all the other representative groups, and these include Autism Tobago, Down Syndrome Network, the Visually Impaired, Disabled Persons International, TechVoc, and our Disability Unit. The intention is that we will pull them together in an association such that they could provide the oversight for these various agencies. The records reveal that an effort was made 10 years ago to have this done, but not yet implemented. And the representatives here felt that we should move again and have this amended and launched such that they can have a framework within which they can work. Again, we've identified a space for them so that they can work from, and we expect to have that formally launched so that they can provide their services. Let me just move to the issue of the payment of salaries. I know that this has been an issue, a major concern for us, and let me just say that, and I'm pleased to do that as well because sometimes we don't always have the information. And so we've paid up all the arrears of wages or daily paid employees. The last fortnight, which is the fortnight ending March 8th, that is now being processed, and that's a current fortnight. All the arrears from November, December, January, February, all have been paid up, so that if you do receive any information that is not the case, that is not in fact so. The facts are that they've been paid up. We've been able to address our administrative challenges such that we've been able to have this dealt with expeditiously. We're grateful for the leadership of the division at this time to ensure that we've been able to meet our commitment to our employees. My final point I want to touch on is some of the areas that we hope to pursue that we've had approved to us. Coming out of our efforts to deal with the issues with respect to family, our collaboration with the Family Planning Association through the Section on Reproductive Health activities that is expected to be formally underway within the coming month. Excuse me. And through the opening of our community residence for children at risk, or collaboration with Children's Authority and ourselves, that too will be brought into focus. We've already started work on our non-communicable disease registry through our policy planning unit. And that data coming out of that will be shared as and when we can do so. But work has already started with respect to that. Our agreement and our decision to establish a health and wellness center through our stroke and diabetes service, that is going to be actioned through the launch of the stroke and diabetes service, about which I have just spoken. The final thing I want to mention in terms of our disabled community, which we expect to roll out in June of this year, and this is a concern that they have expressed, that they aren't caregivers for that particular cohort of within our community, and therefore a training for caregivers specifically with course descriptors to address the disabled children. That is to be that will commence in June. Much of the input in terms of the descriptor has been from the disabled community in shaping that which is the students or the trainees will be taught. I will pause here now for any comments or questions you may have.
Good afternoon, Secretary.
Good afternoon.
Just 1 minute, please, while I find more questions. You spoke about the daycares and that they have to meet a particular standard to be licensed, right? Is it a case in Tobago where many of the daycares are substandard? Have you all found that to be the case, or is it that you just want them to be licensed, even though they may be practicing up to this standard, but they just don't have the license? Is it that you want them to be licensed?
So you have a mixture of both. You would have had persons who are not working with the standards and persons who are with the standards. But for licensing, you must ensure that they all do the same things. Yes? And so the effort is to expose them to what the law says, and so that they will have the time to do the preparation required so that they can come up to the standards for licensing. Because as you know, it is not a service that you ought to have been delivered in the way it is delivered. One must be licensed to do so. Okay, thank you.
So when that time period expires for them to come up to the standard, to be licensed, if they don't make the standard, will their operations be shut down?
That is a decision that will be taken by and is a legal decision by the Children's Authority. Because you have to do, as any other business, you have to meet the standards for providing care. So we won't take the decision. The committee will make a recommendation based on what they've seen, and the authority will act according to the law.
Concerning the payment of salaries to the daily paid employees, to the daily rated workers, you said that there were some administrative challenges. I don't know if you would have elucidated on those challenges in the past, but just for refresher's course, can you tell us exactly what were these challenges, and why would it have taken so long to rectify them?
Well, the why I won't deal with first. Let me just deal with the what. The what is that historically wages were paid late by the division. Even prior to my time, that persons never had their wages paid on time. Even with the presence of the various staffing levels in the department, there were some inefficiencies that needed to be addressed. And therefore, what has happened is that those inefficiencies have been addressed such that we are now able to provide the wages on time.
I have a question here that was given to me by a colleague. There was some Golden Apple caregivers that were engaged in a training program last August. Can you say if they have received their certificates for the training program that they participated in?
They have not. We expect to have the graduation done for them. As you would know, we've had several issues that we had to contend with. The biggest issue would have been dealing with the wages and salaries for thousands of workers that we had to prioritize. Not that that is not important, but we had to take a conscious decision to deal with those. So we have been dealing with wages and salaries. We've been dealing with contracted employees who have not had their salaries as well. We are presently cleaning up that backlog, a backlog created because of the inefficiencies. So that is to be done. We expect that as we commission the new facility, because many of them some of them are already working in supporting children who are not now in that facility, that will be done before then. So that we didn't expect it to be this long, but it has taken long.
But you can't say exactly when the graduation will take place?
I will report to you as soon as we have a date.
All right, thank you.
And Dr. Carrington,
yes,
you spoke about in the program you listed 4 activities for International Women's Day. What was it you said about the month of May, please?
Or the month of May. In the month of May, May is Mother's Day and all of that, and several things would happen in May. One of which is the diet and exercise, right? Women and healthy living, that is expected to happen. Focus group discussions, looking at changing roles of women, because we wanted to find out from our women their lived experiences. So we wanted to do that. And of course, we have, for Mother's Day, we're doing a Step With Me where we are going to provide support. Most people don't pay attention to their feet, yes? And so we wanted to do that and provide for them the kind of foot care and celebrate with them on that day, because we don't, you're a man, right? But we need to pay more attention to our feet because it's a good sign as to some indication as to what's happening with their health as well.
Okay, I asked because the Secretary for Agri mentioned that May would be Eat Local month, and now you're talking about diet and exercise, healthy living. Is there any collaboration expected within the Division of Health?
We are collaborating with all our activities. You recall I mentioned in terms of the women entrepreneurship, we are doing that with ComDev. And so whenever we're doing food, we do it with agriculture when we're doing. So the effort is to collaborate, yes, because we are one executive. Okay.
You also mentioned that possibly in May would be the certain date for the Maria Health Center.
Not possibly, will be in May. Be in May.
Right, so does that mean that there is agreements in place now in terms of the contractor, the scope of works and all of that you would be able to share with us?
And so I won't want to share the specific details. I can share with you the date, yes? And so that, and we will do a notice out as soon as all the areas are finalized. But we know that we have already committed to, and let me just say that we have the funding that we can spend between now and the end of the fiscal year to drive that project, and that's why we are moving to have the turn then and start doing some work before the fiscal period ends.
Would you say who the contractor is for the project?
I did say to you that I would share that with you at another occasion. Yes?
In terms of the ambulance service, what is the fleet of the ambulance service right now, and has the maintenance issues you would have spoken about at exec, are those issues resolved to date?
And so I can say to you that 8 out of 10 are functioning. Let me just say now, 8 are on, how we've done it, 8 are actively on the road. 1 is being used to provide an internal kind of arrangement, so that's 9. The 10th, we actually have 10. 1 is kind of floating. Should something happen and you need another, so that essentially we have 10 that are actively in service. I'm sure you hear them all the time, yes? You don't? Well, I hear them passing the street. I hear them. Maybe they don't have to pass where you, but where I live, they pass to go to hospital, so I hear them.
And in terms of Charlottesville, is one station anywhere?
Yeah, all the bases are covered. All the bases are covered at this time. You can check and see, they're all covered.
One more question, Secretary. There was recently a press release sent out by the Ministry of Health that there's an outbreak of, is it hand, foot, and mouth disease?
Oh, and they were trying to find out for us if he had any cases in Tobago.
Yes. Do we have any cases?
I don't have any data that suggests that we do have in Tobago.
Thank you for staying with us for the Tobago House of Assembly's Post-Executive Council Media Briefing for the week ending March 17th, 2018.